Bruxism is a term used to describe habitual, involuntary grinding or clenching of the teeth, typically during sleep. This condition can lead to various dental and orofacial problems, including tooth wear, jaw pain, and headaches. So there's a few different types of bruxism. So we have awake bruxism. This type occurs when an individual is unconsciously clenching or grinding their teeth while awake, and it may be associated with stress, anxiety, or tension. Sleep bruxism refers to teeth grinding or clenching during sleep. This type is often characterized by rhythmic or non-rhythmic muscle activity during sleep cycles. Now, the exact causes of bruxism are not fully understood, but it's believed to be a result from a combination of factors. So stress and anxiety, emotional stress and anxiety can trigger or exacerbate bruxism in some individuals. It could be down to some occlusal factors, so if you have misalignment of your teeth, otherwise known as malocclusion, or if you have some kind of abnormal bite, it may contribute to bruxism because you can't help the position of your teeth. They may just be kind of grinding over each other based on how your bite is. Central nervous system activity, that is another potential cause, and bruxism can be associated with abnormal neural control of the jaw muscles during sleep. And lastly, it could be down to some lifestyle factors, so alcohol consumption, smoking, and the use of various psychoactive substances may increase your risk of bruxism. Now, in terms of the mechanisms of bruxism, it involves rhythmic or non-rhythmic muscle contractions leading to grinding or clenching of the teeth. During sleep bruxism, the central nervous system can activate the chewing muscles leading to tooth-to-tooth contact and pressure. Awake bruxism can be more variable in intensity and frequency due to some slight conscious control over muscle activity. Now, in terms of the symptoms and the effects, bruxism can have various effects on oral and facial structures. So we'll start to see tooth wear occurring, and the grinding action can lead to enamel erosion, flattened tooth surfaces, and chipping of teeth. Some teeth may become quite sensitive. This is down to the worn enamel, which is now exposing the sensitive dentin layer underneath, leading to increased tooth sensitivity. For example, if you have a cold drink, you may experience more sensitivity. Jaw pain can be another symptom of bruxism. So because you're constantly clenching your teeth, you could have some pain and discomfort in the jaw joint, which is known as the temporomandibular joint. And you can also have a lot of tension in the surrounding muscles. Headaches are another potential side effect, and this is down to the muscle tension and pressure which is associated with clenching your teeth constantly. These types of headaches are usually felt around the temple area. You may develop ear pain because bruxism related muscle tension can radiate to the ears, causing discomfort. You may get facial pain in general. The muscles around the face can be sore due to constant clenching of the teeth. To diagnose bruxism, it usually involves a combination of checking your history, doing a clinical examination. It's usually done by a dentist. The dentist usually will inquire about when you're experiencing the symptoms of pain, when you feel like you are grinding your teeth, because sometimes you may be aware that it's happening, especially if you wake up at night time and you notice you have been clenching your teeth in your sleep when you wake up, or you may wake up with pain in your jaw because you've been clenching your teeth, while you're sleeping. So the dentist will ask like a history to see if you are aware of what's going on. They'll check your teeth to check for any tooth wear patterns, if there's any changes in your tooth alignment, and they'll also check if your muscles are appearing to be tender. And in some cases, if it's quite severe, you could potentially have some kind of sleep study done, where a polysomnography sleep study is conducted to objectively diagnose sleep bruxism. But often it's not really needed because the tooth wear patterns are quite a big giveaway if you have been grinding your teeth. Now, to treat bruxism, it depends on the underlying causes and the severity of your bruxism. The first step is behavioral approaches. So if your bruxism is down to stress management techniques, relaxation exercises, and behavioral therapy can help to reduce bruxism. Mouth guards or splints could be made, so a dentist can fabricate some kind of custom-made appliance which you wear at night time or even while you're awake to help protect the teeth and help reduce jaw muscle strain. Some medications could be given, so muscle relaxants or medications that target anxiety and stress, they can be prescribed in certain cases. If you have a case where your teeth aren't aligned in the correct way, potentially some braces or orthodontic treatment can help to correct your bite, and this may help to reduce bruxism. And lastly, some kind of physical therapy, so techniques such as jaw exercises, massages, hot and cold therapy can help relax the muscles. So we've made it to the end of the video. If you've made it all the way to the end, leave a 100 emoji. If you have any questions about bruxism, leave them in the comment section below. Make sure you like, comment and subscribe, and thank you very much for watching.